A patient has a choice now in our practice between a traditional crown. When I say traditional, I also can make it with a CEREC machine, as opposed to a one-visit crown. Quite often we have a number of patients that come during the week with broken teeth, a corner of the tooth fractured. They might require a crown. They've got a sensitive or a crack in the tooth, and then we give them the options. And one of the options would be a one-visit crown. And when we go through the cost comparison with a traditional crown, some patients would choose the lower cost option, and they're generally surprised that a crown, I've been quoted thousands for a typical crown, but they're quite surprised when you're talking something that is less than $1,000. So in terms of case acceptance, I think there's no question that the one-visit crown has a place for all dentists. It saves the patient a lot of time. I would book the patient in for a 45-minute visit or a 1 hour, as compared to a traditional system whereby you're making at least a 2-hour appointments. And patients don't want to sit in the chair for very long. Situations where, for example, we've done a root canal therapy on the patient and then we've told them they need a crown. Patients said, look, I've already spent thousands on the root canal, and they quite often don't go ahead with the crown. Now, what happens down the track, if a patient doesn't go ahead with the crown, they don't understand that there's a risk of the tooth fracturing. And as a dentist, as a professional, we would like to see that tooth obviously inherently strong after our root canal therapy. So it seems to make more sense that I would rather them adopt some type of procedure rather than place a band but placing an OVC. Patients are more accepting with a lower cost option. So I've done situations where I have to do maybe 4 to 8 teeth in the back, and patients, rather than compared to a traditional crown or an overlay, I think that there's a huge cost saving with the one-visit crown in those cases. When we present a one-visit crown to a patient, I have clinical photos of my before and after cases, and patients are just blown out by what they look like. They don't have to have a silver filling. They don't have to have a large composite that sometimes doesn't look so good.